Section 1. Introduction to heart blocks. Heart blocks, also known as atrioventricular AV blocks, are disruptions in the heart's electrical conduction system. These blocks interfere with the transmission of electrical signals from the atria, the heart's upper chambers, to the ventricles, the lower chambers. Normally, these electrical impulses ensure a coordinated and efficient heartbeat. When this system fails, it causes a range of symptoms and can lead to serious health issues. To understand heart blocks, it's essential to grasp the heart's electrical system. Think of it as an intricate network of wires that ensure the heart beats properly. When any part of this network is damaged or malfunctions, it can slow down or completely block the signal. Heart blocks are categorized based on the degree and location of the blockage. Each type has unique characteristics and varying degrees of severity. Understanding heart blocks is crucial not only for medical professionals, but also for the general public. Early detection and appropriate management can significantly affect outcomes. This guide aims to provide a comprehensive understanding of the different types of heart blocks, their symptoms, implications, and the importance of timely intervention. In the following sections, we will delve deeper into each type of heart block. We will explore how they impact heart function and their relevance in emergency situations. By the end of this guide, you will have a clearer understanding of how to recognize and respond to these electrical failures. Section 2. Understanding heart's electrical system. The heart's electrical system is central to its function. It starts with the sinoatrial SA node, known as the heart's natural pacemaker. The SA node generates electrical impulses that cause the atria to contract and pump blood into the ventricles. These impulses then travel to the atrioventricular AV node, which acts as a gatekeeper, slowing the signal before it moves to the ventricles. From the AV node, the impulse travels down the bundle of His, dividing into right and left bundle branches. These branches spread out into smaller fibers called Purkinje fibers, which stimulate the ventricles to contract and pump blood to the lungs and the rest of the body. Any disruption in this pathway can lead to a heart block. Each type of heart block affects a different part of this electrical system. They are classified into first degree, second degree, which is further divided into type 1 and type 2, and third degree, complete blocks. The severity of the block determines the impact on heart function and overall health. Understanding these blocks requires knowledge of their specific mechanics and consequences. For instance, a first-degree block involves a delay in the signal from the atria to the ventricles. In contrast, a third-degree block means no electrical signals pass from the atria to the ventricles, leading to a complete disconnection. In the next sections, we will discuss each type of heart block in detail. We'll cover their symptoms, implications, and how they vary in severity. This knowledge is vital for recognizing potential issues and seeking timely medical attention. Section 3. First-degree AV block, the mildest form. First-degree AV block is the least severe type of heart block. It is characterized by a prolonged delay in the electrical signal as it travels from the atria to the ventricles. This delay is measured using an electrocardiogram, ECG, and is identified by an extended PR interval. Individuals with a first-degree AV block often have no symptoms. It is usually discovered incidentally during an ECG for another reason. Despite the delay, the heart rhythm remains regular and the ventricles receive the electrical signal, just a bit later than normal. This type of block is generally not considered dangerous and often does not require treatment. However, in some cases, a first-degree block can be a sign of underlying heart disease or other conditions affecting the heart's conduction system. It can also be caused by certain medications, such as beta blockers or calcium channel blockers. Therefore, a thorough evaluation by a healthcare provider is essential to determine if any underlying issues need to be addressed. First-degree AV block can be managed by monitoring and adjusting medications if necessary. Regular follow-up with a healthcare provider is important to ensure that the block does not progress to a more severe type. In most cases, individuals with this type of heart block can lead normal, active lives without significant restrictions. Section 4. Second-degree AV block, Type 1, Wenckebach. Second-degree AV block Type 1, also known as Wenckebach, is characterized by a progressively longer delay in the electrical signal from the atria to the ventricles until a beat is eventually skipped. This pattern repeats, leading to an irregular heart rhythm. It is often identified on an ECG by a progressively lengthening PR interval. followed by a dropped QRS complex. Vincabach is typically well tolerated and may cause few or no symptoms. Some people might experience lightheadedness, dizziness, or palpitations. It often occurs in healthy individuals, especially athletes, and during sleep when the vagus nerve, which controls heart rate, is more active. This type of block can be temporary and may be caused by increased vagal tone, certain medications, or underlying heart conditions. In many cases, no specific treatment is needed, and the condition is managed by monitoring and avoiding triggers. However, if symptomatic or related to an underlying condition, further evaluation and management may be required. Understanding Vincabach is important for distinguishing it from more serious types of heart blocks. While it is usually benign, recognizing the pattern on an ECG can help ensure appropriate monitoring and intervention if needed. This knowledge is especially valuable in emergency settings where quick assessment is crucial. Second-degree AV block type 2, also known as Mobitz II, is more serious than type 1. It is characterized by an abrupt failure of the electrical signal to reach the ventricles without the progressive delay seen in Vincabach. On an ECG, this block appears as a normal PR interval followed by a sudden dropped QRS complex. Mobitz II can lead to more significant symptoms such as fatigue, lightheadedness, syncope, which is fainting, and even sudden cardiac arrest. This type of block indicates more severe underlying damage to the heart's conduction system and is often associated with structural heart disease. Because Mobitz II can progress to a complete heart block, it requires more aggressive management. Immediate medical attention is necessary, and the use of a pacemaker is often recommended to ensure a consistent heart rhythm. This intervention can prevent serious complications and improve quality of life. Recognizing Mobitz II is critical in clinical practice and emergency settings. Quick identification and prompt treatment can be life-saving. Medical professionals must be vigilant in monitoring patients with this type of block to prevent progression and manage symptoms effectively. Third-degree AV block, or complete heart block, is the most severe form. It occurs when there is a total failure of the electrical signal to pass from the atria to the ventricles. This results in the atria and ventricles beating independently, leading to a very slow and irregular heart rhythm. Symptoms of complete heart block are often severe and can include extreme fatigue, dizziness, syncope, and heart failure. Because the ventricles are not receiving the signals from the atria, they rely on their own slower pacemaker cells, leading to inadequate blood flow throughout the body. Immediate medical intervention is crucial for individuals with a third-degree block. The most effective treatment is the implantation of a pacemaker, which ensures a regular and adequate heart rate by artificially stimulating the heart to contract. Without treatment, complete heart block can be life-threatening. Understanding the seriousness of third-degree AV block is essential for timely diagnosis and intervention. Medical professionals must act swiftly to manage this condition and prevent fatal outcomes. Public awareness of the symptoms can also lead to earlier detection and treatment. The symptoms of heart blocks vary widely depending on the type and severity. Mild cases like first-degree AV block may be asymptomatic, while more severe blocks can cause noticeable and debilitating symptoms. Common symptoms across different types of heart blocks include fatigue, dizziness, palpitations, and syncope. In real-life scenarios, these symptoms can significantly impact daily activities and quality of life. For instance, an individual with a second-degree or third-degree block may struggle with routine tasks due to frequent dizziness or fainting spells. This can lead to increased risk of falls, injuries, and even sudden cardiac arrest in severe cases. For medical professionals, recognizing these symptoms is crucial for early diagnosis and management. Comprehensive patient history and careful analysis of ECG results can help identify the type and severity of the block. Understanding the implications of these symptoms allows for timely and appropriate interventions. Public awareness of heart block symptoms can lead to earlier consultations with healthcare providers. This proactive approach can prevent complications and improve outcomes. Knowing when to seek medical help is a vital part of managing heart blocks effectively. Heart blocks are particularly significant in emergency settings due to their potential to cause sudden and severe symptoms. In emergencies, quick identification and correct classification of heart blocks can be life-saving. Medical professionals rely on their knowledge of heart block patterns on ECGs to make rapid decisions. In cases of second-degree type 2 or third-degree blocks, Immediate intervention is often required. Without prompt treatment, patients can experience severe bradycardia, slow heart rate, leading to inadequate blood flow to vital organs. This can result in shock, heart failure, or cardiac arrest. Emergency responders and healthcare providers must be equipped with the skills and tools to manage heart blocks effectively. This includes the use of temporary pacing, medications to stabilize the heart rate, and preparation for potential pacemaker implantation. Training and awareness are key components of emergency preparedness for heart blocks. For the general public, understanding the urgency of heart block symptoms can prompt quicker action. Recognizing the signs and knowing when to call for emergency help can make a critical difference in outcomes. Public education on this topic is essential for community health and safety. The treatment and management of heart blocks depend on the type and severity. For first-degree AV block, monitoring and lifestyle modifications are often sufficient. Avoiding medications that exacerbate the block and regular follow-up with a healthcare provider can manage this condition effectively. Second-degree type 1 block may also require minimal intervention, focusing on monitoring and avoiding triggers. However, for second-degree type 2 and third-degree blocks, more intensive treatments are necessary. The primary treatment for these severe blocks is the implantation of a pacemaker. This device ensures a regular heart rhythm by providing electrical stimulation to the heart. In some cases, medications such as atropine may be used temporarily to increase heart rate until a permanent solution like a pacemaker can be implemented. The choice of treatment is guided by the patient's overall health, symptoms, and the underlying cause of the block. Ongoing management includes regular checkups and monitoring of the pacemaker function. Patients with pacemakers can lead active, normal lives with some precautions. Education on device maintenance and recognizing potential complications is crucial for long-term management. Understanding the treatment options for heart blocks empowers patients and healthcare providers to make informed decisions. Timely and appropriate interventions can significantly improve quality of life and prevent serious complications.